On Nationwide this evening, the importance of taking care of our hearts. The screening centre in Dublin, which could identify heart defects among our teenagers. The Galway organisation, whose work with heart and stroke sufferers is helping to get them back on their feet and to stay healthy. And the tragic story of a family who know only too well the grief of losing their young son to sudden cardiac failure.
You're welcome to Nationwide, and this evening we're focusing on the importance of taking care of one of our most vital organs, the heart. Now in a little while we'll get some advice on heart health, but to begin we're going to meet a family in Cavan whose very sad story demonstrates just how important it is to be aware of the potential for heart problems even with our teenagers.
They're a quiet and gentle couple, Pauline Hankin and Brendan O'Brien, and their great loss could have destroyed them. But it didn't. And together they're making progress on the long, hard road to acceptance and moving on. Their son Sean was 19 when he passed away at the hands of something called sudden arrhythmic death syndrome. It's not unknown, of course, and other families have suffered in similar fashion, each finding their own way through. As we shall see, it was music, writing, blogging on the computer that helped for Pauline and Brendan.
I had gone to Italy for the weekend with my daughter Susanna, our youngest, and I was over visiting an old school friend. And on the Saturday night, I had been texting all day back and forward to Sean, who was here with his dad, and about 10 o'clock in the evening I spoke to Sean briefly. He told me he was at home, it's always sort of, any parent will tell you it's reassuring to hear that they're at home on Saturday night and you can relax. And anyway, we woke up the next morning, Sunday, and I remember the phone going, my phone was on the bed, and I remember it going at about 10, and I saw home had come up, and I thought, what could that be? And anyway, when I answered, it was Brendan, and he said the most awful thing has happened. And I could see Susanna in the room, I could hear Brendan, so I knew, I just knew it was Sean.
I'd said goodnight to Sean here in this room around probably 12:15 the previous night. I came down the next morning assuming Sean was in bed and went to make myself coffee. And when I walked into this room, Sean was sitting in this chair. He was slumped back exactly in the position where I'd left him the previous night, but slumped back. And no sign of pain or distress or anything like that. He really hadn't moved. He had just slumped back in the chair. So it was almost as if he'd been switched off in some way.
In times of crisis, neighbours rally round offering support and encouragement. Now, in the age of computers, the family of Cavan neighbours extends to encompass the entire world. Blogging was making its mark on this very personal road of great sorrow.
I had started a blog the previous May, the May before Sean died, called The Road to God Knows Where. It's very easy to do blogging these days. And after Sean died, I found that very useful to be able to express my feelings, and Pauline's as well, and just to say what was going on. It seemed to help, and I got a lot of nice comments from people all over the world.
A book of magical fiction was in the process of completion at the time of Sean's death. It would play a part in the family moving forward.
This is the book I published in December, a novel for children and teenagers. The picture on the cover actually reminds me of Sean. The main character is a 12-year-old boy, and the designer didn't know anything about Sean. He was a man in England designed it for me, but it just, to me, it kind of looks a bit like Sean, which is interesting, I think. And this has been, publishing it and going ahead with it has been part of the process as well for Pauline and me. It's important to us, part of getting on with our lives.
Sean, the boy called home too early, left treasure behind. It's a modest treasure house of his skills. Photography was a great love. By gum, Sean did it well. This photograph is special. Sean and his girlfriend Cleo, and the camera held at arm's length, a self-portrait of the two that would lead Brendan to put musical words together. Sean's cousin Edine would sing the song.
On the walls some photos show Sean and Cleo in the snow, on streets of Cavan Town, with the snowflakes drifting down.
The parents remember the son now gone, and while understanding fails them, there's comfort in the memories.
We have all the pictures of Sean around the walls, and we kind of feel that Sean is with us here. Definitely, I like being in this house, you know. Sean is here with us.
More than one young person a week now dies in Ireland from sudden arrhythmic death syndrome, I believe. And very often they're very healthy, outgoing, lively people like Sean was, and there's no apparent problem. It just happens completely out of the blue.
It's really the teenage years that this can kind of, the structure of the heart can change in teenage years. Some children might get the odd palpitation or fainting. That's apparently a symptom, not necessarily means that they have this problem, but that can be a little warning sign. Sean didn't have any of that. Sean had no warning signs. But I do believe that, for instance, if people have private health insurance, they should ask their health insurance providers to cover for teenage heart screening, and sports clubs could be doing a lot more as well.
In his deepest dreams I know Sean still sees some Cavan snow. All around the town they go, Sean is laughing with and it always will be so.
As we've seen there, the death of a young family member from heart problems is a devastating trauma. As a result, many families begin searching for answers or wondering if there might be a hereditary factor. Well, now at Tallaght Hospital, there's a free screening service available to establish if there is a heart problem in a family that needs to be dealt with, or as in most cases, to just give the all clear. Niall Martin went along to find out how it all works.
This is a one-stop heart clinic. Based at Tallaght Hospital, the Cardiac Risk in Younger Persons Centre offers a free diagnostic service to those who may have reason to worry about their heart.
Well, the centre we have here is to evaluate people with definite cardiac problems, potential cardiac problems because of family history, or potential cardiac problems because they've had symptoms suggestive of an underlying cardiac disorder. And what we do is we evaluate them here and do, I suppose you could call it a one-stop shop, where we can do all of the basic cardiac tests that you might need to detect a cardiac problem on the same day, and sit down with them and look at the results and give them feedback about whether there is anything to worry about, whether they need additional tests, or whether they can forget about it and move on with their life, all in the same day.
Eunice Jeffers is here today to have her 2 teenage sons screened following the discovery of a family heart problem.
It started off when my husband's family discovered that there was a problem with heart disease in the family, And from him going to his cardiologist referred the two boys on because it's genetic and there's a family history.
You know, we're going to do the echo test now. That's just the ultrasound of your heart, okay? So if you want to make yourself comfortable in the bed there.
This is Simon Jeffers' second checkup. All the necessary tests will be carried out over the next hour and he'll get his results before he leaves the clinic today.
Most people who come into us have a lot of fear and anxiety and often believe that they are at risk of imminent sudden cardiac death, and to be able to most of the time allay that fear, or if there is a problem, to have a plan in place as to what to do about it all on the same day is we think the only way to manage these kind of conditions. But it certainly looks absolutely perfect and I don't find anything wrong. It looks like a very healthy heart.
The service is available countrywide with a referral from your GP.
What we're also working on is, and hopefully within the next 12 months, we will have finalised a protocol with the coroners and the pathologists in the country so that it doesn't take the GP even to refer, but the whole process is initiated as soon as the cause of death has been ascertained, and that people are then advised that they should be checked and then they can be referred here for assessment.
Hand in hand with the diagnostic service is a charity called Croi, run by Michael and Mary Green, who lost their 15-year-old son Peter as a result of an undiagnosed heart problem.
To me it wasn't a grand plan, but it emerged over time. We started with providing, you know, information and support to families. Then it was the screening centre. Now we've added a psychotherapist who volunteers some time with this, which is fantastic. We're moving a step further all the time.
The Croi charity also supports the diagnostic centre at Tallaght Hospital with fundraising to keep it in operation.
What we rely on, because we need the funds to run this, to support the centre and run the charity, approximately 350,000 per annum, which is not a lot of money when you think of what work has been done. But we rely entirely on fundraising events, voluntary contributions, participation in mini marathons, you name it. But essentially it comes down to ordinary people doing extraordinary things, and for that we owe them a huge thank you.
Well, that's Croi, and their website address is on your screens now. We're going to take a break now, and when we come back we're heading off to Galway to see the work that's being done at a dynamic cardiovascular disease prevention centre. We'll talk to you again in a couple of minutes. You're welcome back to the programme, where this evening we're focusing on heart health. Now, heart disease and stroke kill more people in this country than any other illness. And the fact is that 90% of those deaths could be prevented by making simple lifestyle changes and controlling risk factors. And we're going to take a look now at a cardiovascular disease prevention centre in Galway City. It's called Croí, and it's the only one of its kind in Ireland. Our reporter Teresa Mannion begins the story by taking a look at the reality of heart disease in the cardiology unit at University Hospital in Galway.
The cardiac Catlab at University Hospital Galway. Professor Ciarán Daly is about to perform an angioplasty. The patient, a 52-year-old male and a former smoker.
From Menace, County Clare, 52, and his doctors will put a stent, maybe two if needed. I've had two before, earlier this year, and it's been a huge improvement in my whole lifestyle.
If he had stopped smoking, driven his cholesterol down, controlled his blood pressure, he might never have got, and probably would never have got into this situation. But he's been fortunate. He's presented with angina, so it's been diagnosed, and he's had diagnostic angiograms, so we have identified several sections of his coronary arteries that need treatment, and he's going to have angioplasty to sort those out.
Professor Ciarán Daly was instrumental in setting up the National Acute Coronary Syndrome programme, where certain categories of heart attack go straight to the hospital for stenting. But reducing the risk of a heart attack in the first place is still the number one goal.
It's really a waste of time. Smoking, you know, regardless if you're fit and have a good diet, and smoking or don't have a, you know, it's still just a waste of time. You know, you wind up here, or even worse.
It's a classic example of what Croí is trying to do. What we want are the public out there to take on board these messages without having to go through life-threatening situations like this to give them enough motivation to do it.
Let's have the long stride. That's it. One step there and step. And we're going to really work the arm.
A short distance from University Hospital Galway, the Croí Heart and Stroke Charity leads the way in prevention and recovery from heart disease.
Plenty of volunteers here now in Croí, so behind the scenes they're keeping it going. And if I suppose it wasn't for all the goodwill of all the people here in Galway and outside fundraising, this place wouldn't be going. So it's great, there's lots of people working hard.
Croí offers a range of health and lifestyle programmes designed for people with known risk factors, such as family history of heart disease and stroke, people who smoke, have diabetes, high cholesterol and high blood pressure, people who are overweight and don't take regular exercise. These very people are turning their lives around.
I can talk now and do this. When I started, I was concentrating on trying to do this.
Tell me all the weight you have lost.
I have lost over 3 stone weight.
Well done.
I had a stroke last May and I had spent 3 weeks in hospital, and it was suggested to me that maybe I might like to join with Croí and the Stroke Action. They teach you all about your tablets, all about your shopping, what you should be doing. So they actually take you on a shopping trip and they teach you how to do your shopping properly, which I think is an excellent idea.
Well, I think, Teresa, when I passed 20 stone, I felt that it was time to do something. My doctor, Brennan, had been at me for a long time, and I suppose the idea was in my head. I was particularly worried that there was a possibility of diabetes, obviously, with the weight. So when I heard about the programme, I asked my doc to try and get on it, and we got on it, thankfully. And it's been going great, and there's nearly 3 stone gone at this stage, so hopefully we'll keep working on it.
We purposefully don't use any treadmills, bikes. It's a relaxed environment, it's a sociable environment. People enjoy coming and learn to enjoy activity, and that any activity is possible and beneficial to your health.
The Croí Centre was built at a cost of €3.7 million. All of the activities are funded entirely by voluntary contributions, donations and the proceeds of fundraising events.
The model we have here, which basically allows people to walk in to sign on for certain programmes or to be referred by their general practitioner, is a model which works. And there's no reason why a centre like this couldn't be in a number of locations around the country. Massive expenditure in this country on the acute services, and justifiably, obviously, we need to care for people, but if a fraction of that resource was invested in prevention, we'd have a totally different picture.
Typically in the hospital system they can wait several months for any of these tests. It's just because of the volume that's going through the hospitals. So in fact the GPs can refer directly for Holters and echoes.
Change everything.
Yeah.
Everything, what you eat, what you drink, volumes, and you watch fruit, veg, where before you just wouldn't touch it. Now you watch everything.
And exercise?
Oh, exercise. Well, I'm not the greatest exerciser in the world, but they still know whether you do it or not.
I have emphysema from the cigarettes. And I'd say without this place, I would be dead. It's the greatest facility that hit the west of Ireland. And fair play to the people that went around, collect the money, and people that gave their time to it and worked hard at it. It's just brilliant.
Croí also offers free short-stay accommodation for families who need to stay close to the hospital when a patient is undergoing surgery. For Edel McLaughlin from Ballina and Mayo, the support of Croí was invaluable last year. The 35-year-old mother suffered a pregnancy-related heart attack as a result of a tear to a coronary artery.
I feel very lucky to be alive and to be here. So I spent the 3 weeks then in the hospital, which really wasn't conducive to building any kind of a bond with Sarah. I'll never forget the first day that they actually brought her up. It was about a week later. To me, she was my tiny little newborn baby the last time I seen her. And
it was tough.
Mm-hmm.
Yeah.
And I spent the week and a half in CCU, and And Croi were vital in me building up that bond again with Sarah. And only for them, I just don't know what we would have done. We wouldn't have I wouldn't have brought her into the hospital, obviously. So they were vital. And when we came here then as well on the Monday, Neil had a new cot and a new mobile for the cot, and there was little vouchers here for the swimming pool for the older children, and cinema tickets, and it was just unbelievable.
Croí has recently published Healthy Ways, a cookbook and lifestyle guide featuring over 100 tasty, heart-friendly recipes from a number of restaurants.
Hi Campbell, how you doing? Joe.
Joe, how's it going?
New Zealander Campbell White is a chef at the 12 Hotel in Barna. He compiled some of the recipes in the book and is introducing them to Tuam butcher Joe Crampton, who has joined Croí.
So what we have in the oven here is we have some chicken, tikka masala, and we have a chicken burger, and we also have some nice healthy parsnip chips there.
So these are pasta?
Yes.
So how would you have cooked them?
I just brought them, cut them down, peeled them and cut them down, put them in some water, brought them up to the boil, strained the water off, and then I just put them into the tray with a bit of greaseproof paper, a little bit of rapeseed oil, and there's also actually a coating on them as well to make them just that little bit more...
A little bit of spice.
Exactly, yeah, just to make them a little bit more interesting.
Nice.
You
Yeah,
know,
they're
just
beautiful.
because it's low fat doesn't mean it doesn't have to taste good.
After all the hard work in the kitchen, it was time to sit down with the woman behind the Croí cookbook.
Claire Kearns, you're the cardiac dietitian with Croí and you're the author of the book Healthy Ways. This food looks so appetising and nutritious, and it's all good for you.
Yeah, that's the great thing about it. So I suppose this book is really targeted at people that are concerned, Teresa, about their cholesterol, their blood pressure, those that are diabetic, and particularly people struggling with their weight. And as you know, so many people are struggling with their weight. So these recipes are really ideal for people who are generally concerned about their health.
The food is both tasty and healthy in equal measure, and for those who have to be careful with their diet, that's a bonus.
I went to my GP and he sent me in here to Croí. So I'm on a diet since the last 12 weeks. And I've lost 10 kilos now in the 12 weeks.
And Connie, your daughter, has got you a present of the Croí cookbook. It looks very appetising.
Yeah, there's lovely recipes in it, and very healthy and very easy and doable.
Keeping the heart healthy is the primary message for all of us. Now it's a way of life for those who have completed the courses at Croí. These West of Ireland former meat lovers are taking sushi lessons at Raw Restaurant in Galway City's Radisson Hotel.
Eat a lot, especially raw fish.
No guilt, there's no fat in there. I mean, it's only kind of small amounts of cholesterol and all that. So it's great.
Hi, Brady.
Hi.
How do you think?
Very good.
Did you enjoy
Very
that?
good. I certainly did.
Yeah.
It's my first time.
Lovely, grand.
Do you still eat red meat?
I do, yeah, but I might be changing my mind.
It's the most Japanese like me, slim. Yeah? Well, no, I'm eating sushi anyway.
Meat is not a major part of the traditional Asian diet, and heart disease is a lot lower than here in the West. Fish is healthy whether you eat it raw or cooked, along with plenty of vegetables. And the message from Croí: mind your heart by being mindful of what you eat.
A timely message for us all and a reminder of the importance of heart health. The Croí cookbook and lifestyle guide is called Healthy Ways, and it's available from bookshops all around the country or directly from the Croí charity in Galway. And just to let you know that Croí relies entirely on donations and fundraising events. And that brings us to the end of this evening's programme. If you'd like to get any more information on any of the stories that we featured, you can go to the Nationwide website. Sin deir leis an glór, I bhfeadh roimh inis, agus go dté sibh slán.
On next Friday's Nationwide, some of the wonderful attractions of the Garden of Ireland. We're in County Wicklow, where we visit one of the county's finest houses. We see how lime was made in bygone times. We get out and about on Shanksmere to explore the beauty of this part of Ireland. And if all that walking is too much for you, there's always the possibility of letting the horse do all the work on a trekking adventure.